The medication administration segment is used to chart any medications that are given to the sterile field. These items also pull straight into the pick list. You can search for a medication by choosing from the drop-down menu options or by selecting the ellipsis button. You may look up a medication by name, item number, or by typing in a short description. You may need to use the scroll bar on the right to find the desired medication. Selecting OK will return you to the previous screen to continue your documentation. You must document the medication name, dose, route, time, and date given for each medication. To document more than one medication, use the Add button and follow the same steps. After choosing Add and Next, a pick list update box opens. Fill out the yellow highlighted sections by clicking in the field for each line. After choosing the appropriate information from the drop-down options, selecting OK will save your choices to the pick list. If any contrast is used during the procedure, it will need to be ordered and documented in another area of the chart called the Medication Administration Wizard, or MA. To open the MA, select the Medication Administration button at the top of your screen. The on-screen instructions will help guide you through the documentation process. After scanning the patient's armband, a list of the patient's current medication orders will appear. For safety purposes, the recommendation is to scan the armband whenever possible. Select the Create Order and Document button located at the top. A search window will open next, where you can either scan the medication barcode or type in the name if the barcode will not scan. After choosing the appropriate order sentence, selecting the Add Order button will open a new window. Complete the medication order details, such as the ordering provider, communication type, dose, and route. Note all required fields are highlighted in yellow. You can enter in additional details by choosing the Comment button in the lower left of the window. This is where you would document any waste amounts. When documentation is complete, selecting Sign will place the order for the contrast and document the administration simultaneously. Selecting the X in the upper right corner of the window will close the Medication Administration Wizard. If images are taken during the case, you will need to document them within the X-rays and Images segment. Chart the site that was imaged, the type of X-ray performed, and if protective equipment was used. This section also contains a place to document if the outcome was met. By choosing Next, your entry will be saved and the Cultures and Specimens segment will open. This segment is for documentation only. You must fill out a lab requisition to send with the specimen and place an order. Chart the specimen type and where the specimen was sent to. Type in the requisition number, the name of the specimen, and any other details needed within the description free text box. You will also need to document if the outcome was met. Use the Add button to chart if more than one specimen or culture was performed. Choosing Next will move you on to the next segment, the implant log. This segment is used to document any implantable materials. You can ask your preceptor or supervisor if you are unsure what is considered an implantable material. In the description section, you can enter in the implant reference number or select the appropriate option from the drop-down menu. The expiration date, lot, and serial numbers must be documented for each implant. Some data may auto-populate from the system, such as the name of the manufacturer. If not, be sure to note the manufacturer. Document the implant site and quantity used for the case. Use the Add button to chart implants individually that have different lot or item numbers. After choosing Next, a pick list update box will open. Fill out the yellow highlighted sections by clicking in the field for each line. After choosing the appropriate information from the drop-down options, selecting OK will save your choices to the pick list. On the next page, you can document if any reconstitution was performed. Note: tissue reconstitution is only filled in when the fluid used did not come in the packaging for an item. For example, the sodium chloride used for frozen skin tissue used in burn cases would need to be documented in the tissue reconstitution section. Another example can be seen for ortho cases. The BMP used during ortho cases are reconstituted with the fluid that comes in the package. This would not be charted in the tissue reconstitution section. In the dressing and packing segment, you will document the details of the items used, if a cast or any specialty items, like an abdominal binder, were applied, and any wound packing. On the following page, you can document the application of any splints, the type of tape used, and the dressing site. You will also need to document if the outcome was met. Please note that wound vac documentation is done within the free text box area of this segment.